Welcome to At the Table with CAHSAH. My name is Mark Wilson. Support for today's episode comes from Healthcare Synergy. Technology is important, but having the right people behind it matters too. Healthcare Synergy, helping home health and hospice agencies operate at peak performance. You can learn more at healthcaresynergy.com. Okay, this is part two of a discussion that we started in the last podcast. It's all things AI. And again, AI is either going to save the world or it's going to take it over and eliminate humans entirely. So we got to talk about it one way or the other. But this is part two of our conversation with Scott Strong, who is an expert in all things AI. And he's also the founder of Strong Consulting Group Services. And he served home health and hospice agencies since 1993. His work focuses on billing, administrative operations, Medicare reviews, compliance strategy, documentation, and agency workflow improvement. And get this, he's represented clients in well over 1,000 administrative law judge hearings and has assisted with approximately 1,500 to 2,000 ADR reviews. Although I said that last week, he's probably maybe got a couple more under his belt by this time. So anyway, Scott Strong, welcome to At the Table with CAHSAH again.
Thanks, Mark. I think we had a great conversation and it warranted continuance.
I totally agree. I could talk to you literally forever about this stuff. I find it fascinating, but I also think that there are some things, and as we discussed last week, that there aren't a lot of guardrails on this thing right now. And I think people, from what you were saying last week, need to proceed very cautiously with this whole idea of artificial intelligence. So I wondered today if we couldn't maybe break it down just a little bit. I'd like to talk to you about AI in hospice and then AI specifically in home health. And then later on, I have a lightning round of questions for you. So we got a jam-packed podcast today.
Terrific.
Okay. So again, let's talk specifically about hospice. Hospice is of course, intensely personal care. You're dealing with patients and families at one of the most vulnerable moments of their lives. So the question is for you, where does AI belong in hospice and where does it absolutely not belong right now?
Well, you just pointed out something. It is extremely personal. And so because of that, the entire hospice situation hinges on the caregiver or clinician and family members' relationship. From the day-to-day interactions with the patients, I don't see any AI involvement whatsoever. It is still the human part of it, the human connection, that I don't see AI replacing. But on the documentation side, again, with the appropriate guardrails, then AI can assist the hospice in protecting itself and making sure that it's documenting the events that are going on. The weakness that hospice has is that there tends to be lack of evidence of the patient's decline. And so Medicare is looking at it and saying, you could have kept this patient on hospice forever because you're not showing me any decline. They're not essentially leading towards death in a way that Medicare believes that they should have been on hospice. So they'll look at it as you put them on hospice too soon. And so in order to justify continuing a patient on hospice, you better be prepared to hit all the indicators that show that this patient is hospice eligible. AI can assist you.
So are you saying that that AI can identify changes in patient condition, or am I hearing you wrong?
No, you're saying it exactly right. If the clinician is collecting the data adequately in the field, when you measure it against the patient being on service, you'll be able to see the indicators that said that this patient is declining. But that's where AI can help on site, making sure the clinician is getting those indicators.
What about medication and symptom management information? AI good there?
It could help. It could help. Again, I think we're asking AI to be 5 years down the road in saying that a patient meets a certain profile and they're taking certain medications, and these are the appropriate comfort measures. There is not enough collected data to tie all that together yet, that I believe.
Okay, so again, at the end of the day, like again, hospice fundamentally being about the human connection. How do we make sure moving forward that efficiency doesn't come at the expense of humanity?
Um, I don't really see that being an issue. As it is right now, the nature of hospice, I don't see anything that would reduce the amount of services, which is where you would run into that lack of human contact, because essentially you need to be there at key moments and key events. And so you cannot replace that with AI. Uh, when a patient is passing away, you need that person there. You need those comfort measures done. I don't see anybody accepting AI providing that level of care.
Okay, that's actually comforting.
Well, again, as we speak, unless the robots are made and they can slap a robot in there, um, I would want a human to be there with my loved one, telling me what's going on, helping me to handle this transition. And I don't want some AI generated voice telling me everything is going to be okay. This is normal. That's to me, that's not going to fly.
Yeah, I hope not. I hope you're right. I really truly do. Okay, home health presents a whole different set of opportunities, and I know we talked about many of them last week. But you've got, of course, with home health reimbursement pressure, you've got OASIS, quality measures, hospitalization risk, and really increasingly complex patients being treated at home these days. Where do you see AI having the greatest impact in home health today and into the future?
Today, collecting the data. The number one thing AI can do is assist the clinician as they're out in the field, collect the data by making sure that they collected all the required data elements. Did you get all the vitals? Did you dress the wound? Did you take a picture of the wound? Did you measure the wound? Things that are sometimes in the care in the process of providing care are overlooked on the documentation side. Now, once that data is collected, now AI could also assist with guardrails on, are we documenting the same? Are we showing improvement in care? If so, how are we showing improvement in care? Again, this is like all along the food chain. AI can do little bits and pieces to improve the outcomes and the quality of the documentation.
So, could we eventually reach a point where AI helps an agency look at the referral coming in and say, based on this patient's condition, history, geography, staffing requirements, and reimbursement, here's what the episode of care is likely to require?
Yes, but do we want it to? Because then
Yeah,
what's going to happen is cherry picking. I only want the easy cases. I only want the cases that are going to improve my outcomes and my star rating. Once we start going down that rabbit hole, then you're going to get agencies that are going to get slammed because they're only going to be left with the worst cases. So if we get too deep down this rabbit hole of creating algorithms to say patient presents with the following, and this is what it's likely to cost you as an agency, what kind of risk is going to give you with Medicare because of the length of stay that's going to be required. I mean, my mind could go miles with this
right.
on how we could then make patients restrictive. And what's even worse, the government using it and then punishing people on, oh, this is what the standard outcome should be, like they're currently doing in hospice with live discharge as an indicator of whether or not an agency is doing fraud. That is the worst measurement because they're not even taking into and I believe AI is creating that list for them because AI is not smart enough to know that an agency may revoke a patient 2 or 3 times. And if my patient lives in Iowa, they don't have a hospital on every corner. And so they accept maybe that they're going to die and they have family around. It's a more probably comfort position. Whereas you take a person in a metropolitan city and they say, you know what? I don't want to die today. I want to go to the hospital. And that hospital is right around the corner and 911 is going to have an ambulance there in 5 minutes. And so what is the hospice supposed to do? They're supposed to revoke. So I looked at some numbers and they are literally counting the same patients multiple times to come up with this high live discharge rate. So again, for me, I think they're using AI on the government side, and this world will come down to the battle of the AI.
Boy, it would be interesting to know if they actually are. You suspect that they are, though.
Well, I suspect that they are because they arbitrarily picked a time frame from January 1st of 2025 through March of 2026. What's the problem with that? You're overlapping cap years. The cap years from 10/1 to 9/30. Okay. So for instance, they overlapped the cap year that was from 10/1 of 2024 through 9/30 of 2025. Well, why did they do that? Well, statistically, they didn't get the live discharge rates they wanted. So then they brought in from 10/1 of 2025 to March 31st of 2026, overlapping two cap years. And by doing so, now you could create some artificial numbers to say, we want to present this image of high live discharges without even understanding what the live discharges were. So
Yes.
that's tremendously dangerous. And these people are still under suspension since April. They're not getting any relief.
Wow. Wow, that's hard to wrap one's head around, really. But let's talk about one of the danger zones and what I think some of the folks worry about. Healthcare information isn't the same as asking, GPT where to go for dinner. We're dealing with protected health information, right? We just had that conversation, a little bit of that conversation before we started the podcast. You've got clinical records, you've got extremely sensitive information. What should every home health or hospice leader understand before employees start putting information into an AI platform?
You nailed it, that they're not supposed to. They're not legally supposed to put any confidential patient information into the web at any aspect at any time. Unless they have an associate business agreement with that AI engine, they're not allowed to do it. And people are doing it. And what they're doing is, hey, take a look at this patient and code it for me. Or, hey, take a look at this patient and generate a note for me. That's all illegal.
So this raises an interesting management question then. So employees might already be using AI, whether leadership has approved it or not. And I don't care whether it's, drafting an email or whatever they're doing. Should every agency have an AI policy right now, today?
You nailed it. Yes, sir. They better create guardrails of their own for their entire office, all their staff, to say what is allowable AI usage in the context of patient care.
So what is that? Okay. Can you expand on that policy a little bit? What should it include?
It should include anything patient care related being uploaded with any patient identifiable information into any form of AI engine.
Okay. Any kind.
Okay. Any kind.
Even just a standard chat. I want to put an email together. I want it to sound really good. I want to put it into ChatGPT.
Does it have patient information that is identifiable? The answer is no.
Yeah. Okay.
I mean, I recently had a provider that sent a letter to CMS with patient identifiable information. CMS says you can't send it to me. Now you're CMS. You're supposed to have ultimate authority over all medical records. And they said, well, you cannot email it. You cannot hard copy mail it. You could submit it by FedEx or through a secure portal.
Let me step down here for just a minute and thank our sponsors for today's podcast, Healthcare Synergy. Running a home health or hospice agency today isn't getting any simpler, folks. You know that. That's why providers turn to Healthcare Synergy. For more than 30 years, Healthcare Synergy has helped agencies operate more efficiently with powerful EMR technology, clinical services, billing and revenue recovery, and the kind of expertise to help you navigate in an increasingly complex healthcare environment. Remember, technology is important. We all know that, but having the right people behind it matters too. And for my money, maybe even more. So Healthcare Synergy, helping home health and hospice agencies operate at peak performance. Learn more at healthcaresynergy.com. That's healthcaresynergy.com. And by the way, Scott, I want to have that conversation with you someday about agencies and picking vendors. What do we look for? What kind of things do we have conversations about? Because there's lots of people entering this space, and some people have been working at it for a long, long time, and some people are seeing opportunities and jumping in quickly because of those opportunities. So I think that would be a fascinating discussion for us to have too.
Well, I think you'll find that quite a few of them are probably not going to last for a couple of reasons. Um, as a software vendor, they get the necessary agreements with the uh, artificial intelligence engines that allows them to submit healthcare records through them. But what they're finding is because of their lack of knowledge, it's going to cost them a ton of money in order to have chat digest this information and then, based on a simple prompt, then provide an answer, because chat now has to do all the research that it believes is appropriate and return a result. Okay, well, that's using up those token thingies. And so they're finding they're burning through tokens, delivering their product. And so it's, in all honesty, using AI at the current pricing models is not really effective. And it's slow.
Here's a question, I think, and we touched on this a little bit last time, but here's a question I think healthcare ultimately has to confront. AI can be incredibly convincing, um, and it can also be wrong, from what I'm told. So
It literally says it at the bottom of the screen that it can be wrong.
it does?
Yeah, if you go into ChatGPT, at the very bottom, it says ChatGPT can be wrong.
I have never seen. I'm going to have to look for that today after we're done here.
Look it up. You'll
Not
see
that
it.
I'm-
It literally says it
Not
right
that
there.
I'm not
It has
questioning
a
you, but I've
disclaimer.
never ever
Yeah.
seen. It must be in that small print like they have in the drug commercials. Like
It
you know.
really isn't that small. It's just that whatever you were doing was more interesting than that little blurb that's right under the box where you type in your question.
Yeah,
It's right under the box.
I got to look for it. But if AI recommends something, generates documentation or identifies a clinical issue, and that information turns out to be incorrect, who's responsible?
The person that asked the question.
It's as
ChatGPT will
simple as that.
never.
It's as simple as
Yes.
that. Then
If you went with the answer, then it's you that made the decision. Chat just gave you a suggestion
see,
and you ran with it.
and see, that's where I think the danger is for me. That's where I get concerned, because I think that over time, and I'm finding myself doing this, I'm finding myself saying that AI is the authority, but it really is an assistant. And we got to keep thinking about it, correct me if I'm wrong, as an assistant, not as the authority.
So when you are querying chat, anytime you know less than chat or Claude or whatever, we're not focused on one, then you tend to accept the answer. If you know, or if your knowledge in the particular area that you're asking it, then you will start to see the mistakes and you'll have less trust in it. So again, if you know less and you're searching for something because you know less, then you're in trouble. That whole hammer with the nail thing.
Yeah.
If you know and you're looking for a research partner, then you're incredibly efficient and you're really, really good. Because you know when you're getting the wrong answer and you can force it to help you get the right answer.
Got it. Okay. Let's kind of tee up our next conversation, because you and I are going to talk more in future podcasts. Let's say I'm running a home health or a hospice agency today. I'm listening to you. I'm listening to this podcast. And I say, okay, I get that AI is important, but I don't know where to begin. And I know that's a really broad question, but
Yes.
Monday morning, where do I start on Monday?
Again, I guess it depends on where you are in the food chain. If you have zero understanding of AI, you don't even have a clue where to begin, because it all sounds terrific. It all sounds life-saving. It all sounds, time savings and efficiencies. But if you understand that AI has its weaknesses and its flaws, and you're hesitant, then you know to ask a particular vendor, how are you utilizing AI specifically? Is it doing everything? Do you have the institutional knowledge so that it's not doing everything? I need to know, how are you implementing AI in your product? Because that makes a difference. Because again, that just tells me you know less than I, and you're relying on AI to give me an answer and you're charging me for it.
Right.
Whereas someone that has extensive knowledge in the areas can talk to you without AI and explain that AI is the assistant as we've been discussing.
Okay, I'm going to ask you. I know you work with a lot of agencies. What's the biggest mistake you see organizations making or potentially making with AI?
My people aren't, honestly, because
Because they've
I'm,
got you.
well, I don't want to say it that way, but in all reality, they trust me enough to ask me what I think and where do I think this technology is right now. And my answer is we're still in the learning phase and we need to know what they're doing to create what's generating these answers. And my biggest concern is the exposure to CMS if we adopt platforms that are not truly compliant. And so I'm more on that end of it. They can promise whatever they want. They really don't want to see me coming because I'm going to ask them, how are you coming up with that answer? Just tell me exactly what is and you don't have to give me your secret sauce, but you have to let me know how you know the answers that you're giving.
By the way, Scotty, you're open for business. How do people get in touch with you if they need some help?
Well, that is the tricky part. I'm not advertising.
Okay. All right. All right. All right.
But I mean, there could always be the right
Listen, tell you
client.
what, I'll be your conduit. People, you can get in touch with me.
Yes,
I'll
yes,
call Scott and I'll ask him the question.
yeah. Because I honestly, at this stage of life, I generally only work with people that know people that I work with.
Got it.
Because there's a lot of folks in this business for the wrong reasons, and I have zero interest in just making money. My clients are like family.
That's
And
great.
so, if they're suffering, I'm suffering, and I want to know that the person I'm suffering with is worth suffering with.
Well, we need you. So maybe we ought to do the whole like separate podcast, you and me. We'll just like every week we'll get together and have this sort of roundtable discussion. That would be awesome.
The time frame is good for me, but we could definitely discuss it.
Okay, good. Listen, let's do a lightning round. This is where I ask you, I've come up with several questions and we just kind of go through them real quick, if that's okay with you. You ready for that?
Yep, shoot.
Sure you can handle it now?
I think so.
Okay. All right. AI replacing clinicians, realistic or ridiculous?
Ridiculous.
AI generated clinical documentation, game changer or dangerous?
Significantly dangerous because essentially AI is not the one assessing the patient. So therefore it should not be creating documents.
Biggest untapped AI opportunity in home health?
Utilizing its ability to digest a lot of information and apply it according to rules that the agency has.
Biggest untapped AI opportunity in hospice?
Mainly very similar. I think as more and more data is collected, it will give hospice agencies more information about length of stay and some predictive things that will be rooted in actual data and actually the hospice cap. The vast majority of folks are in hospice and have no idea what the hospice cap is and how it's calculated.
Okay, continuing. Where am I here? Here we go. The AI risk providers are not paying enough attention to.
Staff utilizing it to do its work in an uncontrolled environment.
Just a couple more.
Mhm.
This is a good one. I like this. I'm looking forward to the answer to this. One job in home-based care, AI will dramatically change in the next 5 years.
Quality assurance. It will allow someone that does QA work to process more charts because they don't have to try and absorb the content of the record, but yet absorb the deficiencies of the record.
Okay. And finally, just a general question. 5 years from now, again, will we wonder how we ever operated a home health or hospice organization without AI?
Same question. How did we ever function without a cell phone or the internet?
Scotty, I did. I
Well,
tell you
you
what, I
did.
love my cell phone, but I hate my cell phone.
Only because it's a 24/7 device. But realistically, the internet And the cell phone has revolutionized everything we do and has made us so much more powerful than we ever would have been.
But I got a feeling that you might be old enough to remember this, where you could jump in your car. We didn't have mobile phones. The car was the only place you could get away from everybody and not have to not have to answer a phone. And now that's just not possible. So
Well, I'm gonna put it out there. I'll be 59 this year, so I remember pagers.
so do I.
Okay, I remember pre-pagers. Okay, I remember having to physically write a note
Yeah,
and hand it to someone.
yeah.
You couldn't text while you were in a meeting to someone in the room, and now you guys are collaborating in a room full of people. Yes, I remember it, and I. It's not that I long for it, because to me, just get in your car and turn it off.
No, I know, but you feel compelled. Like if someone's trying to get a hold of you, they know they can get a hold of you, even if you're in your car. But yeah, I remember the
Yes,
pagers, and you'd get the message, and you'd have to stop at what? A payphone. Yeah, where you put quarters in the
coins
phone,
in. Yes, yes,
right?
yes, yes. But think about it like this: you can actually now get calls in the air. You could get text messages in the air, email. So I never stopped working.
Right.
That is a fact.
Okay, Scott, I could, like I said, I could do this all day with you. You're just such a great guest and full of so much information. So I appreciate you, and I'm looking forward to our next podcast. I know we're going to do some more. Keep in mind, folks, that technology is clearly moving quickly, and healthcare organizations are going to have to balance innovation with, Scott was talking about, privacy and compliance, and most assuredly accuracy, and really just good old-fashioned human judgment. So, Scotty Strong from Strong Consulting Services, thank you for spending some more time with us at the table with CAHSAH. Thanks, too, to Healthcare Synergy. And thanks to all of you for listening and watching, or however you are consuming this podcast. At the Table with CAHSAH is available on Apple Podcasts, Spotify, YouTube, and at CAHSAH.org. CAHSAH.org. My name is Mark Wilson. For everybody at CAHSAH, Scott, thank you again. And we will see you next time at the Table with CAHSAH.